Good afternoon, everyone. I'm Braden Monaco from Blue Horizon Benefits. It's that time of year again. It's the time of year for us to look at, address, and select our benefits during our annual benefits open enrollment. So the goal for today is to really just talk high level through the benefits that are going to be offered this year. You guys already received an email from the team there outlining some of the changes that are occurring. So we really want you to feel comfortable after this meeting with the changes that are being made, the networks that are being provided, the tools and resources that are being provided to you as an employee and as a member of the plan. We're really excited to provide a really strong benefit partnered with A+ navigators, or folks that are really going to help you understand and guide your care. So I'm going to share a little bit of information with you today as it relates to the benefit plan, starting with the medical. So starting with the medical plan, we have
to get cheap gas.
Possible to mute.
Conference.
They didn't have any of that.
Wow, they have this right at the door.
Yeah, no.
Is it possible? Is it possible? Okay, thank you.
All right, so back at it, the 2022 benefits open enrollment. This year will be provided, the healthcare will be provided with a large national network provided through a healthcare platform called AlaraCare. Many of you have read the email already from Stephanie, but it will be with the national network of Cigna. So you're used to a large national network today with United Healthcare, but moving forward, it'll be a very similar national network in the Cigna PPO network. So this gives you freedom to seek care anywhere that accepts the national full network of the Cigna Choice Fund PPO. The medical plan is made up of a few different components that you as a member will interface with. First and foremost, we want to introduce you to the healthcare guides. This is your A+ navigator. The A+ navigator is going to be someone that's going to be there to support you, one click or one call, to help you understand cost and quality of care and help you understand your benefits even further. But we'll talk about that quite a bit at length as we go through the presentation. The other two components that you really are going to interface with mostly are your network, right? We mentioned Cigna being the national network of providers. So that's your primary care doctors, your specialists, your hospitals, all of your ancillary facilities that you will access through the Cigna network. And then your pharmacy benefits. So today you're used to going to the pharmacy or having a mail order pharmacy for a prescription drug. That'll be no different moving forward. It'll just be a different benefit manager or pharmacy manager that you're utilizing. AlaraCare partners with Drexy, who calls themselves the Honest PBM. And the goal there is for you to help you understand the cost of your prescription drugs based on different pharmacies. But we're not here, the plan is not here to limit your access to your prescription drugs. It's trying to provide transparency and understanding of cost as where you're getting those prescriptions. So again, you have access to a national network through Cigna. The Cigna PPO network has 15,000 hospitals and facilities nationwide, 840,000 providers. So very large national network. All of your hospitals in the state of Massachusetts and New England are covered. Obviously, we'll want to make sure we check all of your doctors, but we did do a primary care doctor match for who's on file today. We had a 97% doctor match. There were a couple that we either couldn't find or were not on file. So we want you to look those up or call the navigator ahead of time to find a doctor in network. One of the most important parts of AlaraCare that was built into the plan is the idea of $0 primary care visits. So the Affordable Care Act made it so that all of your preventive care visits were covered at no cost through your current plan. But moving forward, this will be no cost copay or no copay and no cost for any visits within your primary care setting. So the goal is to not limit you from seeking your primary care visit. We know that if folks use their primary care doctor as kind of the gateway to their medical needs, a significant amount of the downstream costs and complications that you may see can be avoided by just seeking care at your primary care doctor. So that includes your annual wellness visits, just like it does today, sick visits. So if you or the kids are sick or someone in your family sick, and you go to your primary care doctor for a doctor's visit, there's no cost associated with that. And then telehealth. One thing you want to note is obviously these are for independent doctors. Some doctors are through hospital settings or such. So you just want to be mindful of where you're going for your primary care visits. Again, something your A+ Navigator, which we'll talk about a little bit more, can help guide you and help you understand what your costs would be based on where you're seeking care. So again, meet your A+ Navigator. These are what I like to call your healthcare's concierge. So, today you go to a new hotel in a new city, you go up to the concierge desk, you ask them where the best restaurant is, or where can you go to find, a rental car or whatever it might be. Healthcare should be no different, right? So the goal here is to provide you with an app, which you can either call in or you can text message with a navigator. To understand where you're going for care, understand where the closest MRI facility is, where what's your doctor's rating, what is the cost of your prescription drug going to be, et cetera.
Hey, Braden, sorry to jump in. Looks like we got someone in the waiting room. It's possible to let them in.
Sure. So the A+ Navigator can do a whole slew of different things. And again, we want the A+ Navigator to be your one click and your one call. This is the place you go to start your healthcare journey, no matter where you're at in the process. So they're both health guides who can help guide you through your healthcare purchasing and where you're going for care. But they also have clinical support. So they can help make PCP and specialist recommendations, help you find facilities and ancillary facilities. They can do a comparison on your prescription drugs to help you understand whether it's, what your cost will be at a CVS versus a Walgreens versus a Walmart. They'll also help you understand your benefits, right? So you can call in with questions about coverage, or how will a certain service be covered, or what will your out-of-pocket costs look like. They're there to answer any questions related to your health plan specifically, and they can do that specifically for you, not just high level, but specifically for you and the plan that you choose. Billing. So if you get a bill in the mail and you're not quite sure how to interpret it or understand it, you can call in and they can help you understand and advocate for you if the bill is billed inappropriately, or you just don't understand the bill. They can really help you understand that as well. So really we want to emphasize that they are there for you to outreach to help answer any questions, help guide your care, find a doctor, look up cost and quality of certain facilities. Other side of that as well is they're going to, the A+ Navigators are actually going to proactively outreach to the members as well. So, so if you are someone on the plan that's managing a chronic condition or has to have a procedure up and coming, the A+ Navigators are going to be intimate within your plan, and they're going to be able to outreach to you and check in. So more proactive than reactive is the goal, right? So, you might not call them, but they might call you. So we want you to be aware that, they are a teammate of yours. They're part of your healthcare team, and they're helping you, manage care along with your doctors on any of the facilities you're currently seeking care at. So again, looking through the A+ Navigator, obviously there's a lot of emphasis here on the A+ Navigator because it really is the gateway for you to have better access to quality care and understand the cost you're going to pay for that care. So they can book appointments for you. So if you call in or text and say, I have to have a primary care visit or a specialty visit, they can help you find that doctor. They can help you book the appointment, and they'll confirm the appointment with you. So they're going to help you find obviously locating imaging centers that you can seek at, getting an MRI or labs or things of that nature at no cost. So using them to help guide your quality and cost journey is important. So again, they're there to support you throughout the entire process of your healthcare purchasing and healthcare journey. So one of the things a lot of people don't understand in regards to healthcare, because we truthfully, as consumers, we haven't really been trained this way, is that you can shop for your healthcare based on quality and cost, just like you do anything else. In this case, a new refrigerator, your car, people look up, home entertainment systems and try to look up the ratings on them and what's the cost versus quality. This is something that's readily available in the healthcare space, but not delivered to the consumer in a clear and concise way for you to make an educated decision. So another reason why the A+ Navigator or the healthcare guides are there to support you understanding cost and quality. So here's just an example: an MRI scan of a hip, knee, ankle, or foot with and without contrast. They can look them up. So an example here is Spalding Rehab Hospital versus Peabody Imaging, which is right in Peabody, obviously. The difference in cost for the same service, right? So there's a drastic cost differential as it relates to services in certain hospital settings versus tertiary facilities or freestanding facilities. And when we get to the plan design, we'll explain to you a little bit more about how you making educated decisions as a consumer and as an employee of the school can actually see much lower costs out of pocket when you seek care. So that leads us into the medical benefits. There's 2 plans being offered. So right now you currently have 2 plans being offered to you as well through United Healthcare. Moving forward, it will be 2 plans with the Cigna network being offered via AlaraCare solution. So the first plan is a PPO 1500, has an annual deductible of that 1500 for an individual, 3000 for a family. These both plans are PPO plans. So you will see there is an out-of-network component. Anytime you have a choice to see a provider or hospital or doctor, whoever, in network, your costs will be significantly lower, but you do have the ability to seek care outside of the Cigna network and on an out-of-network cost share. So you can see the deductibles are higher, out-of-pocket maximums are higher, co-insurance after deductible is higher, et cetera. So my focus today is going to be talking through the in-network benefits, but just know that those out-of-network benefits are available. And if for any reason, again, if you find out your doctor is out of network and you want to try to find an in-network provider, you'll have the link to do so, or after July 1st, when you're enrolled in the plan, you can just outreach to the A+ Navigator and they can help you do that. So the first plan, again, has a $1,500 deductible for an individual, $3,000 for a family. Out-of-pocket maximums are $3,000 for an individual, $6,000 for a family. I really want to highlight this piece because on your current plans, the out-of-pocket maximums are almost twice as much, right? So there's almost $6,000 for an individual, just about $12,000, actually a little more than $12,000, I believe, for the family. So it's very important to understand that the plan was built with intention for your out-of-pocket costs to be lower. So when you think of your annual out-of-pocket maximum, that's the most you can pay in your plan year. So from July 1st to next of 2022 to the end of June of next year, the most you as a member, one person on this plan could pay is $3,000. And that's inclusive of your deductible expenses, any co-payments for specialty care or urgent care, or any other co-payments from emergency room to prescription drugs, even this piece of co-insurance, which I'm going to introduce to you a little bit now in a second. So going through it, again, primary care is no cost. One thing I want to highlight as well that's really important for society in general these days is mental health. The AlaraCare plans provide no cost mental health. So if you find a Cigna provider, there's no cost to you from a mental health perspective. So there'll be no copay associated with mental health visits, which is a great benefit. Any other specialty benefits outside of the mental health would be a $45 copayment. And then your urgent care benefits. So if you go to AFC Urgent Care there in Beverly or Minute Clinic or whatever it might be, there's a copayment of $45 as well. So just like most plans these days, we want to urge you to use urgent care over an emergency room whenever you can. The emergency room itself has a $200 copay. If you are admitted into the hospital because of that emergency, then the copay itself ends up being waived. And then you just go into your deductible and co-insurance. So in the example here would be an inpatient stay. So an inpatient stay would be your deductible of $1,500 per individual or per individual in a family unit. And then you have 20% co-insurance after deductible. Coinsurance is new for your plan as it relates to inpatient, outpatient, and the other services. So what ends up happening is, if you have a bill that's over $1,500 that goes towards your deductible, or that's your responsibility, whatever that bill is, you're going to pay 20% of the difference up to a maximum of $3,000. All right. So, if you have a $100,000 service, God forbid you have some major inpatient stay, you're going to have a $1,500 deductible. You'll have another $1,500 of coinsurance, and then the rest will be covered by the plan. So, but the most you could possibly pay is that $3,000. So, it all depends on kind of how you seek care and where what care you've had prior to any visit as to how the cost share will be. But again, remember, in any given year on this plan, you'll pay no more than $3,000 for an individual or $6,000 for a family. So now getting into outpatient / inpatient elective surgeries. Again, deductible, then 20% coinsurance, just like the inpatient. But one thing I want to point out here is that anytime you have the ability to call into the A+ Navigator and seek guidance as to where you're going to go and have your care, there's the ability to have your out-of-pocket costs waived by utilizing the recommendations of the A+ Navigator. So an example would be if I have to have my knee scoped or a hip replacement or shoulder surgery. If I call into the A+ Navigator and I say I have to have a shoulder surgery, say my rotator cuff, and they say, okay, Braden, within a 20-mile radius of your house or a 40-mile radius, we have these 3 facilities, and based on the cost and quality of these facilities, we can waive the costs associated with your deductible and coinsurance if you seek care at one of these facilities. Keep in mind, they're going to recommend facilities that have a high quality and a lower cost, right? So the goal is never to just find the lowest cost facility. The goal is to find the highest quality facility that's within affordability of the plan, right? So they're really just trying to give you the tools and resources to be a consumer and understand that, you may plan to go to Dr. Jones for that orthopedic surgery, and he might have a quality score of a 23 versus they might say, or you can go over to Sports Medicine North and Dr. Smith has a rating of 97, right? And they can give you all the detail as to how that rating came up. That's all information that's filed with the Department of CMS. So they're not just making these things up. They're not just guiding you where they want to guide you. They're going to provide you the tools and resources and information to make an educated decision. If you say, what, I still want to go see Dr. Jones, even though he's more expensive and has a lower quality score, you can still do that. They're not there to stop you from seeking care in the way you want to seek care. They're just there to help you. In that case, you would just have your deductible and then your coinsurance after deductible. And that goes for these other services that you see below as well. So scans, so MRIs, PET scans, CAT scans, deductible and coinsurance if you just go and seek care wherever you choose to seek care. However, if you seek care at one of the recommended facilities from your A+ Navigator, the costs associated with that can be waived. Durable medical equipment as well. We always urge, especially with durable medical equipment, to call in because a lot of the durable medical equipment pieces of equipment are sourced from other parts of the country, or they're purchased and brought in or delivered to your house directly. So there's really, in a lot of cases, there's no reason to seek or see someone where you can have a deductible and coinsurance where the Navigator could help you find that and have the cost waived. And then one other important piece that the AlaraCare plan offers is labs and X-rays in an office setting or an independent lab have no cost to the member. So if you go to your doctor's office and your doctor's office runs their own labs, then there should be no copay associated with that for you. Or if you choose to go to a Quest Diagnostics or a LabCorp, a freestanding independent lab, independent meaning outside of the hospital setting. The rationale behind that is just things in hospital settings in general are inherently more expensive. So back to our example of the MRI earlier, even outpatient surgeries, sometimes you have a same day surgery that's done in a hospital versus an outpatient center, drastic cost difference. So the kind of the gist of the plan that I want to really focus on here is that when you're going to seek care, we really hope that you'll utilize the A+ navigators, because they're there to really help you understand your cost, the quality of care you're seeking, potentially catch things and, in from a clinical perspective, if prescription drugs were, were prescribed from different doctors that weren't communicating, they're there to be part of your team. So I can't emphasize that enough. Then heading into the next plan design, everything I just explained pretty much stays the same except for your deductible and your out-of-pocket max. So the way the plan functions in regards to copays for your primary care, mental health, how the A+ navigator can help you get your cost waived, all of those things stay exactly the same. The core benefits are the same. What's different here is how much of a deductible you're willing to pay out of pocket if you seek care. So in this case, there's an annual deductible for an individual of $2,500 and for a family of $5,000. The out-of-pocket maximum is $5,000 for an individual, $10,000 for a family. Obviously, on the out-of-pocket, out-of-network benefits, those are increased as well. So the real decision as a member, someone looking to enroll in the plan, is what you're looking at for, and you want to choose for your annual deductible for you and or your family. So, in regards to the deductible, if you are someone that doesn't heavily seek care, most of your care is primary care and maybe mental health, or use an urgent care here and there and have a generic prescription drug, maybe you do buy the $2,500 plan or select the $2,500 plan, because even if you have to have a knee surgery or an MRI, you can always call in and have that cost waived if you seek care at one of the recommended facilities. So those are the medical plans in a nutshell. One thing I will mention that's not directly built into this slideshow, but will be in the detailed plans. One of the things that the school decided to do as well is put in a hearing aid benefit. So there'll be a hearing aid benefit added to the plan. It's $2,000 per ear every 36 months. So if you need new hearing aids coming onto the plan this year, it is certainly something you can take advantage of, that the plan will help offset some of those costs, which was a great benefit that most health plans do not offer hearing aid benefits, especially for adults. So just some quick highlights here. Your current plan with United Healthcare versus the AlaraCare. Are there any ways to save on out-of-pocket costs? Current plans, there's really no one that's going to guide you and help you understand cost and quality and where to go. Versus the AlaraCare plan, there's many options. Obviously, no cost primary care, no cost mental health. Waiving copays for services if you call into the navigator. So there's a lot of areas in which you can save from an out-of-pocket cost perspective, as well as the out-of-pocket costs on the plan itself even being lower. Obviously, from a network perspective, very important to ensure that we have a large, robust network. So matching up their national network was very important. And then easy to get help and recommendations. From our experience as advisors, a lot of insurance companies are really difficult to get on the phone. They can't make recommendations as to where you should go based on cost and quality for a lot of different reasons. But the AlaraCare plan is really built for you as the member to understand that, recommendations and support is only one click or one call away. And then, one of the things that AlaraCare talks about, and we can put them to the test on this one, I'm sure, but is focused, obviously customer service, right? Is the insurance industry, the NPS scores, which is a net promoter score, on average in the insurance industry is a 27 versus the cumulative partners combined to build the AlaraCare product have an 84 net promoter score, which is far above the industry average, which is really important when you're trying to provide a level of care and a consumer experience that's different than most insurance providers. Prescription drugs, this is obviously somewhere that's something that's really important for many of you, and something I'll spend some time here kind of educating you a little bit on how the prescription drugs will work and how you can better utilize AlaraCare and Drexy to find prescription drugs at a lower cost. So obviously prescription drugs range from costs, depending on what pharmacy you go to. So with Drexy, which is the pharmacy benefit manager, the one that manages the benefits, right now it's Optum with United Healthcare. So just kind of put a point of comparison. Drexy has over 65,000 pharmacies, all large national chains, local independent pharmacies as well. So just know that no one's here. The plan's not here to tell you can't have your prescription drugs or make you change things specifically. But the goal is to help you understand, again, cost associated with your prescription based on each pharmacy that's within your area. So we have the plan that's being offered has the generic, brand, and specialty tiers. So 3 tiers of coverage. Your generic tier is $15 copay. Brand tier is a $30 copay. Those high cost specialty tier 3 is a $20 20% coinsurance, or 20% of the cost of your prescription, to a maximum of $250. Okay, so if you have $1,000 medication, it'll cost you $200, et cetera. And then when you look at the 31 to 90 day retail or mail order, it's traditionally the first 2 tiers are two times, and then the specialty tier is kind of just more of a convenience benefit. As it relates to, so from a pharmacy perspective, I want you to be sure you understand that with Drexy, you can still get your prescription drugs filled at whatever pharmacy you're using today. So CVS, Walgreens, Walmart, wherever it is. But we again urge you to either use the Drexy app or call your A+ Navigator, and they're going to actually help you understand, because in some cases, you could be filling a prescription drug as a brand name medication at one pharmacy, and it might be a different at another pharmacy, or the costs associated with it. Let's just say a generic. Some generic costs are, let's say it's $15 at CVS. You might be able to go to Walmart and get it for $5. So it's important to understand that, again, not here to tell you you can't go somewhere, but the real goal is for you to understand that there's tools and resources available to note the costs are associated with your prescription drugs at each location. I want to focus on specialty medications for a minute. Depending on how you and your family members utilize prescription drugs, specialty medications are those traditionally that you see on TV, heavily advertised, really expensive medications treating some very, very severe or chronic conditions. Obviously very important to the consumer that's taking them. But what we want you to understand is that there is a way through Drexy and the AlaraCare plan, in conjunction with their partners, to source those prescription drugs at no cost to you as a member. So give you an example, if you were taking Humira, which could be on average, $5,000 to $7,000 a month. If you have to pay 20% coinsurance, you're going to pay $250 a month for Humira. If you source it and use the A+ Navigator to help you with the prescription drugs, there's a way for you to get those prescription drugs at no cost to you or your family member who's taking them. So there's a significant savings annually from a cost perspective by utilizing the pharmacy benefit in the way that it's built to help you. So that's something I really want to emphasize, that if you're on a medication for a severe chronic condition, we really urge you to call Drexy, call the A+ Navigators, get the conversation going. You may even get an outreach call from the A+ team, from the clinical operations, who are there to help support you through any questions or concerns, and helping you try to find ways to decrease your costs on healthcare. But again, if you're on one of those medications, you could even let me know ahead of time, and I could support you and getting the ball rolling to understand your options before the 7/1 effective date, if that's something you're comfortable with doing. We're here to help. So actually, I'll go back to this one second. With any medications, whether it's specialty, generic, brand, anytime you're switching from one plan to another, it's really important that you just try to get one last fill in with your current plan. So if you're on a plan today, if you can get your plan, your prescription filled before the end of the month for your July prescription, that's really helpful because sometimes there's a lag or sometimes there's an approval process or something that has to go through depending on the prescription you're in on. Sometimes it takes the pharmacy a little while to process your insurance, et cetera. So anytime you can get a prescription drug before the plan change, which would be 7/1 in this case, it's really important that you do so if you can do that. So this, I don't know if this went out yet via email, but it will be going out as well. So the two different plan designs, obviously there's different costs associated with those two different plan designs. Obviously your PPO 1500 will be a little bit more cost per paycheck than your 2500. So this is kind of where your choice is as an employee, as a member of the plan. Do you want to have a lower deductible knowing that you're going to use it a lot? Or are you okay with the $2,500 deductible, lower cost per pay? But other than the deductible, the benefits are exactly the same. So prescription drug costs are the same, networks are the same, co-pays associated with all of your doctor's visits, et cetera, are going to be the same. So it's really a decision over, do I want to pay a little bit more for a lower deductible, or if I'm not a heavy utilizer and I really rarely use healthcare, maybe a higher deductible makes sense, knowing that I can get my costs waived if I use the guidance of my A+ Navigator, et cetera. So important dates, open enrollment, Employee Navigator, we'll get there in a second, is open today through June 17th. I will make a plea that if you can get in there sooner than later and make your selections, it'll allow for a much smoother transition. But we wanted to leave it, you guys, you ample time to make decisions for you and your families. Obviously, this is an important decision. But if you can get in there, the sooner you get in and do that, the better off it'll be for yourself as well as your teammates. The plan is effective July 1st, just like it has always been in the past. One important thing to note, there will be a follow-up meeting on July 5th when the summer session comes back in. It's really the intention of this is really going to be to talk through the A+ Navigator demo. So the Elara Care team will give you a full demo on how to download, utilize, understand, and manage the A+ Navigator app, and then give you some helpful tips and tricks as it relates to your health plan. Member ID cards, obviously, with the time frame, a lot of times the ID cards are delayed. But we will get you a digital ID card prior to July 1st for you to have access to. So again, if all of you got into the Employee Navigator sooner than later to enroll, we could even expedite that a little bit sooner than if we waited till the 17th. But we're going to leave it open for you all to make your decisions. Let's get HR contact. Everybody knows Steve, and then obviously, again, I'm Braden from Blue Horizon Benefits. I'm here as well as my team. Andrea and Chris, as well as Eric, to kind of support you through this process. The Elara Care team will be there to support us as we go through it. And then once you're enrolled, the A+ Navigator will be there to support you as well. A couple of frequently asked questions. Do I have to see my primary care provider before seeing a specialist? The answer is no. On a PPO, you do not have to. But we do believe that primary care visits are very important. So we always urge you to, seek your primary care before you go see a specialist, especially the fact there's no cost. So the Elara Care plan certainly removes the financial barrier of entry into the healthcare system by making it no cost. And then, can I keep my doctor? So long as your doctor is in the Cigna network, you will see no disruption at all, and you know the in-network benefits. If you were to keep your doctor and they're out of network, you can certainly do so. You can certainly keep your doctor, but there's a higher cost again associated with seeking care. If you have trouble looking up and finding your doctor before July 1st, you can always contact our office as well to help you see if you might be looking it up incorrectly, or they might be associated with a different a different facility or whatnot. Kind of just covered this. So if my doctor's not covered, you're going to have an higher out-of-pocket cost. So the co-insurance will be higher associated with the medical care that you seek from that doctor. And then lastly, again, that timeframe employee navigator is live. It's ready for you all to head in, enroll in benefits. Again, remember your company identifier if you don't remember, CCC BSD. You all have your own username and password. If for whatever reason you don't remember that, you can say forgot your password right on the site. But again, our team is here to support you if you have any questions. So my goal now, I want to talk through a couple of other benefits outside of the medical plan. I'll go through those and then I can open up questions for the medical plan.
So I do need to run in a few minutes, so I just wanted to thank you. But I just want everyone to know, I'm going to send out an email tomorrow and it will have a short list going. It'll have the plan design. So you have those numbers as like a cheat sheet right in front of you. I'll send out this presentation. If you ever want to go back and look at more information, I'll send you the date for the A+ demo. That'll be during our orientation day. I'll remind you of the open enrollment dates, and I will also send you the information for Employee Navigator. So everything we just talked about will be listed in the email. Okay, so that'll come out tomorrow. The recording may take just a little bit longer to come out. That might be early next week.
And Stephanie, if it's okay, hi everyone, I'm Steve Wilds. I lead operations at Elara Care and thrilled to be working with you. So if everyone, in terms of questions about care or prescription medications, the sooner you can ask those questions, the better on our end. We're going to jump right on it and make sure that you have everything you need. So if there are questions and you're willing to reach out confidentially now and ask us those questions, our team greatly appreciates that. Versus the last thing we want is anybody to have a situation where they're uncertain of what to do in that moment when they really need it. So again, we'll help you then too. We're here to serve, but if you're able to ask ahead of time, it's greatly appreciated.
So whose contact information at Elara Care should I give them?
Braden, would that flow through you for
Yeah,
now?
you can start with me and then I'll loop them in and you know, if an employee wants to reach out to me and say I have a question, I can connect. You know, if it's personal and they don't want to discuss it with myself, that's completely understandable. We can directly relay you to the Elara Care team prior to the 7/1 date.
Perfect, thank you.
Yep.
Thank you for letting me jump in.
Of course. So we obviously every year we make the benefit highlight sheet. Can you guys see my screen right now?
Yes, it might be helpful to make it a little bit bigger.
Thank you, TT. All right. So the main focus here I want to touch on, we went through all the medical, but there is highlights of the medical on here as well. I want to touch on dental. Again, dental plan is staying with the Guardian. You have a calendar year benefit of $1,500. Same exact benefit you've had for years on your dental plan. So really no changes there. There was a slight change on the deductions per pay by a few pennies, not a big number there. But again, you have 3 types of care: preventive benefits, basic benefits, and major benefits. Depending on where, what level of care you're getting, the insurance plan covers a different percentage. So if you're getting preventive benefits, it's 100% coverage. Basic benefits is at 80, majors at 50, but not a ton to highlight there. One thing I do want to highlight is really the vision plan. In the past, for the folks that enrolled in the medical plan, the vision plan was included. The goal here was to kind of remove it so that you can enroll or decline vision based on your needs. So you'll see the vision plan is also through Guardian. However, it does use the VSP network, which is one of the largest national networks for vision care. And we match the benefit you have today. So an exam copay is $10, material copay is $25, frame allowance $150, and then elective contacts is $150 as well. So, and then these are your deductions per pay period. So when you go through the system, you will be able to elect or waive the vision plan individually. So those of you that, are on the medical but don't want vision, you can waive that as well. The company still has the life insurance, the $10,000 life insurance benefit, as well as voluntary life and voluntary short-term disability. So those will all be available for you to review as you're going through Employee Navigator. As well as an Employee Navigator, you will also have access to what we put in there, a bunch of helpful information from AlaraCare. So there's a welcome kit. There's a member ID tour of your card. So you can look at your ID card and see what all the pieces of the ID card are going to look like. There's some A+ Navigator quick start. So how to get started with the A+ Navigator. Again, some of these won't be available until you're actively enrolled in the plan on 7/1, but I wanted to provide you as much information as we could, so you can start educating yourself and learning a little bit about how all the tools that AlaraCare provides you can help you decrease your costs, find higher quality care, and really help manage your overall health care. So from a perspective of today's meeting, I think that's all I have. Again, I want to emphasize the fact that the AlaraCare team and plan is here to help support you. By no means, when you start looking at guides and navigation, people get a little concerned at times. The goal is to really help you in your journey, not limit you from where you're seeking care. And that's why there is a PPO network to help you with your network and make sure you have a full network. I can open it up if there's any questions of anybody on the call. But again, if it's a private matter, by all means, you can reach out to us individually and we can help answer those questions individually as well. I think that's all. Thank you very much, Jenna. Thank you for your help today.
Thanks, everyone.